Hi, I am Dr. Anoop S. Pillai, consultant orthopedic surgeon at SUD Hospital, Patna. I specialize in adult joint reconstruction surgery and also sports injuries. Today, I would like to talk to you about osteoarthritis, a problem that is very common among the elderly that leads to joint pains and thus difficulty in movement. Basically, osteoarthritis is a wear and tear of a joint. Joints, as we know, is a system which allows for free movement between two bones so that movement is pain-free. And this is made possible by the presence of connections between the joints as well as certain lubricating surfaces on the top of these bones. With use, there is wear and tear of the car tires that we use or any machines that we use, there would also be some wear and tear of the joint surfaces. And when this wear and tear makes the movement of the joints painful or less mobile or stiff, we call that osteoarthritis. In our part of the world, the most commonly involved joints are the knees, certain joints of the hands, and to a much lesser extent the hips. The knees are more commonly involved in the female gender than in the males, but males can also be affected. It usually starts off with some difficulty in trying to get up from a squatting position, sitting for long in a chair, walking on uneven surfaces, managing stairs, etc. Slowly they increase in their intensity so as to interfere with our everyday activities and thus can be hampering to the patient. It is at this stage that patient usually comes to us doctors or sometimes in other cases some indigenous medical systems of medicine. Most often, these patients can be managed by symptomatic treatment, that is management of pain and also certain exercises and some activity modification. But the key thing is to get the problem diagnosed as a simple wear and tear. It could be a symptom of a problem that could be much worse. It could be a symptom of an infection. It could rarely even be a symptom of a tumor. So it is important that we see a doctor, make your problem diagnosed and make sure that we are dealing with a simple wear and tear issue. Like I said, the joints are a system to make way for easy and pain-free movement, and this is supported by various ligaments and also the muscles of the body. Most often the pain is to a large extent because of the inadequate muscle support or too much weight or stresses that are put on these joints. So in a large number of cases, the symptoms can be abated by sticking on to some basic rules like weight reduction. Weight reduction would go a long way in reducing the pain of our osteoarthritis, specifically knee joint, and also simple exercises to strengthen the muscles around the knee joint and also keep the joint smooth. So you have to keep these joints moving. Rest would not get you anywhere. What you need would be short periods of rest when you have severe pain, but after that, controlled movement and simple exercises that help strengthen these muscles of the joints. Avoid going outdoors on pretty uneven surfaces, but walking is good. Walking on level ground cannot do you much harm in the early stages of osteoarthritis. Climbing very high steps, on the other hand, can be bad, but low steps, as we usually find in our homes, are usually not a big problem for osteoarthrosis. So like I said, osteoarthrosis or degenerative joint disease is usually a simple problem that can be to a large extent solved by simple exercises and also keeping your body weight down and certain activity modifications. But do not always assume your knee pain to be of osteoarthritic in origin. Get yourself checked. Like I said, it could be resulted from an infection, a tumor, or osteoporosis. Get yourself checked, get the advice of your doctor, and lead a healthy life.